Hi, I'm Dr. Colin Morton, the National Lead Investigator for the UK for this study concerning the randomized multinational non-inferiority phase 3 trial to evaluate the safety and efficacy of BF-200 ALA gel versus MAL cream in the treatment of non-aggressive basal cell carcinoma with photodynamic therapy. The study was performed to compare the nano-emulsion BF-200 ALA gel with an already approved topical medication, the methyl aminolaevulinic acid cream formulation, in the treatment of non-aggressive basal cell carcinoma. The BF-200 ALA, known as amylose, is an approved drug for use in photodynamic therapy for mild and moderate actinic keratosis and for field cancerization. Because of it being an established treatment for AK, the BF-200 ALA was thought to be a good option for the treatment of basal cell carcinoma, and the study is looking to examine the efficacy of its use. The methods were to perform a randomized non-inferiority observer blinded phase 3 trial with an ongoing follow-up extending out to 5 years. Now, 281 subjects were recruited from 24 study centres across Germany and the UK. Individual patients had between 1 and 3 biopsy-proven superficial or nodular basal cell carcinomas that were classed as low risk. The sites of the lesions were on the face, scalp, trunk and neck, as well as the extremities. The photodynamic therapy was performed by a standard protocol that involved the application of the photosensitizing agent, covered by light tight dressing for 3 hours, and subsequently the dressing was removed and illuminated using a red LED light probes in a standardized regimen. The study schedule is as shown, involving a cycle of photodynamic therapy involving 2 treatments 1 week apart, with subsequent follow-up and assessment as to whether a repeat cycle of treatment was required. Patients then entered a prolonged follow-up study period that is extending out to 60 months. Now, the main results of this study are listed here per protocol, as well as full analysis set, with the per protocol set showing 93.4% overall patient complete response rate at 12 weeks for the BF-200 ALA treated group, very similar to the 91.8% overall patient complete response rate for the MAL PDT group. If we look to the subgroup analysis for superficial basal cell carcinomas, a very similar response rate, 94.7% with BF-200 ALA, 96.4% for MAL. For nodular lesions, it is noted that the numbers are much smaller, but there was a numerically higher response rate of 85.7% with BF-200 ALA PDT compared to 76.2% with MAL PDT. 12 weeks after the last PDT treatment, 94.6% of lesions were clear following BF-200 ALA PDT and 92.9% clear after MAL PDT. Further subgroup analysis is shown, again showing the similarity with superficial basal cell carcinomas, numerically higher response with the nodular basal cell carcinoma lesions, and a numerically higher response rate but with very small numbers with face scalp lesions, 82.4% clearing with BF-200 ALA versus 70.6% with MAL PDT. Concerning additional follow-up results, the patient complete recurrence rate at 1 year was nearly identical with 8.4% following BF-200 ALA PDT and 8.5% with MAL PDT. And a lesion recurrence rate after 1 year of 6.7% with BF-200 ALA and 8.2% with MAL PDT. The cosmetic outcome was rated very good or good 12 weeks after last PDT in 60% of the BF-200 ALA PDT patients and 49% with the MAL PDT treated patients. Very similar patient satisfaction results of 87 and 86% respectively for the BF-200 ALA and the MAL PDT group. In terms of treatment emergent adverse events, they were as expected, typically local reactions, and in the majority of cases mild to moderate severity. And pain during PDT was recorded with a maximum pain sensation between 2.4 and 4.5. The study is relevant as it is showing overall high efficacy rate and low 1-year recurrence rate with the use of BF-200 ALA PDT, and that this was a non-inferiority design of study, and that the estimated 1-year clearance rates calculated for the BF-200 ALA patients or individual lesions estimates were over 86%. The study included not only superficial but nodular basal cell carcinomas, and although numbers are small, there was a numerically higher response rate with the BF-200 ALA treated lesions. And local adverse reactions were as expected in this treatment group and were typically mild to moderate in severity. The study is relevant, supporting the evidence of European guidelines rating a high quality of evidence and strength of recommendation associated with PDT for superficial and nodular basal cell carcinomas, and that BF-200 ALA was shown to be an excellent alternative for non-aggressive basal cell carcinomas that are particularly identified for lesions that are unsuitable for surgery because of size and location.